Oh, good afternoon. Thank you for coming out today. It's really a privilege to have been able to spend really most of the day here at the University of South Carolina. Yesterday, we were in North Carolina. We had a little bit late departure. We got here about 11 o'clock last night, and it's really a privilege to meet with the community, meet with the students, meet with the leadership here, including the president. I just want to say to every South Carolinian, thank you for all the work that you've done over the last 2 months to really combat this epidemic, and we can see that. We can see, since we were here 8 to 9 weeks ago meeting with the governor, real progress in people wearing masks and social distancing, and I just want to really applaud everyone in South Carolina for really following these really critical common sense approaches to preventing the spread of the virus. Early this morning, we arrived on campus while most of the students, I think, were still sleeping. It was a real privilege to be on the University of South Carolina. I think what was inspirational to me personally is seeing what the leadership did from March until now to really ensure that they could bring students back to campus. They didn't put their heads in the sand. They tackled a very difficult issue head on with a very dynamic plan. And what do I mean by dynamic? They have a plan, and they had a plan, but they continue to modify the plan based on the information and the data and the science, and they have very much been driven by that. I think what was really inspirational is seeing the community, the county, and the university come together with students to plan a way forward in this difficult time of this pandemic. I think as we called on universities about 5 months ago to really look internally and really activate internal testing. The testing that we have through the nucleic acid testing that we've been utilizing in this country, between 700 and 800,000 tests a day, really is needed for clinical diagnosis and oftentimes community level testing. So we called on universities to really bring their scientists together and really create new tests to be able to utilize in surveillance of students. And I really want to applaud the University of South Carolina, who heeded that call, developed an assay, worked with others to make sure that it was a high-quality assay, submitted it also to the FDA for emergency use authorization. It is that test, as it continues to expand and ramp up, that is going to be available for really testing South Carolinian university students. And I think that linking of testing with isolation, quarantine, and care, and really understanding what the care piece means, providing that space, but also the food and the support so that students can successfully quarantine and isolate and move through this virus together. We were privileged to go through the healthcare facility. It is an extraordinary facility built after H1N1 with negative pressure rooms and really extraordinary ability to meet the needs of every student. And I think it was having that healthcare facility that gave them the confidence to really be able to ensure that they could care for the students here. We also were able to meet with the community and really understand the community's concerns as a federal group when we saw what South Carolina was doing and how important we thought it was to really work with students. We're working on sending a surge testing team to this area to really dramatically even further expand testing to be able to ensure that all of the asymptomatic cases are found and can be successfully isolated and cared for. Then we talked about what routine surveillance would look like going forward, either using student ID numbers or other ways in order to encourage student testing. We are really grateful for the president and the leadership team who found a path forward to really keep students in college. Why do we think that's important? We know that many students live off campus and have that housing. We know across this country, millions and millions of university and college students have moved to college towns independent of whether that college was online or in person. We believe having these in-person parts to the college experience is not only critical, but critical for public health. So students know where their care can be gotten, knows where the testing can be had. And so really taking that responsible road forward and creating an environment where students can be protected, communities can be protected, and really ensuring that they're student and community focused to really create a plan that has not only been excellent on paper, but has really been implemented in a way that we are really going to take this information back to other university campuses to really highlight the work that's being done here. And we were privileged to meet with student leadership, 4 of them over the last few hours, and I want to really thank them for really working with students to really encourage students on testing. So to every student out there, if you watch any traditional media, thank you for the work that you're doing to wear a mask, socially distance. Thank you when you have done something like going to a party in a neighborhood. Thank you for coming forward and getting tested. And to every South Carolina individual who just got through Labor Day, please know that most of our spreading today is happening in neighborhoods and family gatherings, where just because we know someone, we think that there's no way that they could have COVID. But I want to tell you, you can't tell. And so over Labor Day, if you had a family gathering and you had your masks off and you were close together, please go get tested. We know that asymptomatic spread is occurring. It's occurring between and within families. It's occurring during neighborhood parties. We really encourage all of you to continue to get tested when you've had that kind of exposure so we can stop community spread. I'll stop there and see if there are any questions. So that's really critical. We've talked to the public health individuals from the state, and we want to thank the governor's representatives who've been with our meetings today, because we talked about the importance of moving to what we call front of the nose testing or saliva testing like the university is doing, so that people are not discouraged from being tested. And that's why I really put that call to action out there, that if you've been on vacation, if you've gone to a hot spot, if you've gone to a party in the neighborhood, if you took your mask off and were not socially distant, you really need to get tested. We are sending in surge testing. It should be here sometime at the end of this week, beginning of next week, to really come to Columbia and help with expanded testing, because we've noticed the same thing, and we want to ensure that cases are found. Because people will be enormously responsible if they know that they're positive, and they will do the actions that they need to protect others. We just need to make sure that people have the access to testing, and we encourage testing. Yes, ma'am. We've been very encouraged. In fact, I think you may know we write governor's reports every week. We highlighted Arizona State University and their saliva testing. We've highlighted Rutgers and others. In all of those cases, they ran head-to-head comparison between traditional testing and saliva-based testing, and have found in most cases, 100% correlation between test positivity in the gold standard and test positivity in the saliva-based test. It really has to do with mostly being a different collection type of approach rather than a totally different test. And so they have found great correlation. So we have asked not only universities to go saliva-based testing, but even in routine healthcare provision to really move to saliva-based testing once they have validated it on their pieces of equipment. Yes, ma'am. So we had a great discussion about that. I think yesterday they were up to significantly more tests. I think today they hope to do 600 to 700. Their goal is to get back to where they were, which was 1,300 tests a day. Those of you who know me know that I always want more. So we talked about how we can double that by running 2 shifts and really getting to 2,800 to 3,000 tests a day. That allows you to test the entire student body every 10-day period. Students, before you go home, before you go to anyone who has a vulnerable person in your household, please get tested, because really we know that people under 25 are particularly asymptomatic. And I want to be clear, no one is intentionally spreading the virus. They don't know they're positive. They really don't have any substantial symptoms. And so finding those individuals, the only way to find them is through testing and prevent that further spread. And so we really talked about not only how to get back to the 12 to 1,300 a day, but how to get to really twice that number. Yes, ma'am. So I have been on the road, so I have heard these things have happened overnight and while I was en route, and so I haven't really seen any of that to date. So I thank you for this question, and we'll try to get back with you, because we're in a car. So we left Washington at 7 a.m. yesterday, and I haven't been near a TV yet. I know in the times that I have presented to anyone in the administration, they have taken the data that I have shown them very seriously. Yes, sir. So I always, I have a lot of respect for people in the United States. And so I think right now people are focused on the college students and those pictures. But I will remind you, just a month ago, we were taking pictures of large family gatherings on beaches and in backyards and in neighborhoods. And so I think our nature is to want to be with others and to socialize. And I think what we're asking people to do is to socialize smart. And that does involve mass and social distancing. And when people get themselves in trouble is when they're primarily inside, although outside can occur, and they're close to one another without their mask and usually eating or drinking. So there's a lot of potential exchange of viral particles. And so we've been very clear about that. We think students will be very restrictive in their behaviors when they know that they're positive, and we see them respect that issue. I think other than that, we really have to provide safe vehicles for activities and entertainment that meet all of our needs for some level of socialization. At the same time, we respect one another with the ability to maintain social distance and some type of protection for each other. I think students should know if one of those opportunities happened, to please go and get tested. Probably not the very next day, wait 3 or 4 days, and then go and get tested. I think that's the responsible piece. We are not perfect individuals. We all, in the moment, will have a lapse in judgment. The critical thing is for them to follow up with the responsible behavior getting tested. Yes, sir. I give the same recommendations to all Americans, no matter their position. You need to provide mass social distancing. Outdoor events are safer, and I think we can see gatherings that have occurred outside of political events, as we just described. And I think what's really important that we inform the public how to be engaged safely. And we do believe that there's a common sense path forward. And not only is it a theoretic that we once developed on paper, but has actually been implemented state by state, and you can see the dramatic improvement across the southern states. I call your attention to where the South was 2 months ago and where the South is today. And what they did is smart mitigation. masks, socially distancing, making communities aware of their risk, ensuring that vulnerable populations were protected, ensuring we were washing our hands and protecting one another. But I think critically, each of us taking that personal responsibility and realizing that it gave us the freedom to interact with one another, to go to the mall, to go to Starbucks, to be out in public, but just providing those clear guidelines and standards. And those are the clear guidelines and standards that every American should be following. Yes. So I am an extremely impatient person. I'm trying to tone it down. Ask my daughters, they'll tell you I still am. So when we see this level of ongoing infection, when we see the level of fatality that even though it's down and down significantly, is still ongoing, I want a vaccine that's safe and effective as fast as possible to really make it available to the American people. Now, what I'm doing is doing the opposite that you need for a vaccine, and that's working with every state and mayor and community to get cases down. Because in order to test a vaccine, not only do you have to immunize the individuals, but those individuals have to become exposed to the virus and get infected, because you're comparing the arm that didn't get the vaccine to the arm that did get the vaccine. And so as we work together to bring down cases, it makes the ability to, the timeline, particularly unknown. And so right now, there's immunizations occurring across the United States, across age groups, across race and ethnicity. But I can't predict to you, will that person, after they've been immunized with both doses, run into the virus in their community and become infected? That is the unknown. That's what makes us impatient. But we can't give you a specific timeline. What I can tell you is right now, there's safe manufacturing occurring around these vaccine products, and needles and vials being procured, and CDC's working with every state so that they're ready with a distribution plan, and we've gotten advice from outside groups of who should be the first in line to receive the vaccine. So all that planning and preparation has gone on so that we're ready, but I can't give you a precise date. But I would have liked to have one before this started. So, I mean, I'm impatient that way. But I think all of us can do more to bring down cases and bring down mortality by doing these simple personal pieces to really ensure that we don't infect others. Well, great questions. So first, hopefully you all are getting your flu vaccine, because if you look at year over year, usually the South ends up with the first cases. And so people in the South, first cases of flu. So they really should be right now getting immunized as the flu vaccine becomes available to the general public in the pharmacies and other places. Secondly, if we all do what we're supposed to be doing about wearing a mask and socially distancing and washing our hands, like the Southern Hemisphere, this may be one of our mildest flu seasons, but that really is on each of us to continue to do those activities. So the activities that I'm talking about that prevent COVID can also decrease flu cases. They can decrease what we call respiratory syncytial virus, adenoviruses, rhinoviruses, and other coronaviruses. So it really will cut down on respiratory transmission. I don't know about all of you, but you should have had the least number of colds this summer. And remember, those summer colds can be quite dramatic. And so really, I hope every person is realizing how this approach is not only decreasing their exposure to COVID, but can decrease their exposure and their infection with other respiratory diseases. So thank you. Thank you for your work that you do every day. And thank you for getting the information out about how every person in South Carolina can protect themselves, whether they're in the university or in one of the beautiful towns and counties of this great state. Thank you.